Good evening, everyone. Welcome back to RAAONLINE and myself, Dr. Rahul. Today, we are going to discuss about total intravenous anesthesia and target control infusion pumps. These TCIs and TIVAs are the recent advances in anesthesia. Mostly, we are using TIVA in the conventional modes or in the conventional way. But nowadays, because of the development of the sophisticated TCI pumps, we are now putting TIVA through the TCI pumps, and these TCI pumps are designed specifically depending upon the pharmacokinetics and pharmacodynamics of the patients and the drugs. It is very useful, and we can give anesthesia to this TCI pump very easily. So coming to the definition of TIVA, it is a technique where intravenous agents are used to induce and maintain general anesthesia, avoiding the use of inhalational anesthetic. So why we avoid inhalational anesthetic? Because these inhalational anesthetics are different side effects. Nowadays, we are also concerning about the global warming and also the environmental hazards or environmental effects of inhalational agents. Therefore, we are in a concept of TIVA right now. Second thing is that these inhalational agents had so many problems and so many pathological aspect of the inhalational agents like halogen hepatitis, development of fluoride ion, accumulation of fluoride ion, methoxyfluorine will cause some amount of renal damage. But nowadays we have good inhalational agents like sevoflurane, desflurane. But besides this, but we have to concern about the environmental aspect of the inhalational anesthetic, and we are much more passionate about now giving TIVA. So what is the goals of TIVA and what are the domains of TIVA? There will be very smooth induction in case of TIVA. It is a reliable method of giving anesthesia. We can maintain this intravenous anesthetic so treatable patients, and there will be rapid emergence. So whatever the goals, smooth inductions, rapid emergence is our goal in every aspect of anesthesia and every aspect of general anesthesia. So we in the TIVA we achieve this type of goals, and it is very much reliable also. So coming to the indication of TIVA, there are some specific induction. There are some specific indications in which we are not able to induce the patient, or we are not able to maintain the patient with inhalational anesthetic because of the some risk factor of the inhalational anesthetic. In case of malignant hyperthermia, all the inhalational agents will trigger this malignant hyperthermia. So here it is a first indication for TIVA. Long Q2 syndromes, it is a relative contraindications for inhalational agent, but some of the agents will prolong the QTC prolongation, and they will increase the QT syndromes. History of severe PONV, because we all know in AFL score it is also written that nitrous oxide will stimulate this PONV, and this propofol will decrease the PONV. So the patient who are in a severe risk factor for PONV, we use TIVA rather than inhalational agents. Surgeries requiring neurophysiological monitoring like brain surgeries or spinal cord surgeries. We have already read in exam, we have already read previously before that SSCP monitoring or BIS monitoring, some of the inhalational agents will interfere in this neurophysiological monitoring like nitrous oxide. So we are bound to use TIVA. Non-theater environments. So besides, without the help of workstation also, we can easily give TIVA through normal syringe pump or through normal IV anesthetic agents. In the non-theater environments like NORA, when we are practicing NORA, it is advisable to give TIVA. Transfer of anesthetic patient in different locations. We have to rely on the IV anesthetic rather than inhalationals, like transfer the patient from OT to ICU or transfer the patient from endoscopic suites to OT. Like that, we can use TIVA as a drug. Sedations in intensive care unit, definitely we need TIVA, but nowadays anaconda like vaporizers are discovered, so we can also give inhalational agents in ICU, but considering again the environmental aspect, we can use TIVA here. Tubeless ENT surgeries and rigid bronchoscopy, where we are going to induce the patient with high frequency jet ventilations or high frequency oscillatory ventilation, we can use TIVA. Thoracic surgery, it is better to go with intravenous anesthetic rather than inhalational. Intracranial surgery, because all the inhalational agents will increase the ICP, and all the IV anesthetic mostly except ketamine, they decrease the ICP, and they will increase and they will maintain the electrophysiological activity of the brain. So therefore we go for intravenous anesthetic rather than inhalationals. Procedure requiring sedation like endoscopy and cardioversions, we also go for intravenous anesthetic.